Hello friends, welcome. And we'll be discussing something about schizophrenia. Let's start with the historical notes. In 1860, a Belgian psychiatrist, Moriel, presented a case of a boy who was 13 years old and was brilliant, but later showed symptoms. The diminished interest in studies. Remember, he was brilliant, but his interest in the studies was gradually diminished. Socially withdrawn and loves to remain in a secluded place. He seems to have lost memory of academics, had ideation of murdering his father. He admitted all this to genetics by observing these symptoms, rather the consequences of some kind of disorder in that boy. Moriel attributed these to genetics and named it dementia praecox, a kind of mental deterioration at an early age. Then Swiss psychiatrist Bleuler in 1911 introduced the term schizophrenia, which basically means splitting of personality. This term was introduced basically to describe the condition mentioned by the Moriel. Hence, from then, the word or the term schizophrenia came into the psychological literature. Definition: the functional psychosis in which individual loses connectivity with the reality. This is not the merely definition of the schizophrenia, but USP of the schizophrenia. The main aspect of schizophrenia is the individual loses connectivity with the reality. It's a descriptive term for a group of psychotic disorders which are characterized by gross distortions of reality. The same thing, the reality got distorted. Withdrawal from social interaction, that's obvious consequences, and the disorganization and the fragmentation of perception, thought, and emotion. Concludingly, the cognition is the first casualty of the schizophrenia. There are four major domains of cognition that suffers distortion. That is thinking, perception, language, and sense of self and behavior. What is the global impact of this mental disorder or the functional psychosis? It is estimated by the World Health Organization that globally around 2 crore or 200 lakh people suffer from schizophrenia. Now, when it starts, its roots, the onset occurs during childhood and most likely during late teenage years to early adulthood, that is 15 to 30 years of age. So, what are the clinical features of process schizophrenia? The chronic and long lasting due to several factors such as genetics, biological, or the psychological. Means these are the three major factors which contribute in development of the schizophrenia. That is the genetics, some biological factors, and some psychological factors. Apart from that, there is a gradual loss of interest in the social system. Individual engages in excessive daydreaming. The emotional expressions are blunted. Then individual start responding with inappropriate behavior. The responses are inappropriate. Whereas individual is highly sensitive to the external and the internal stimuli. Now, the clinical features of reactive schizophrenia. This is a different one from the process schizophrenia. The symptoms for brief duration in response to stress, tension, or other environmental factors. Here, individual responds, react to the environmental stimuli. So, in a sense, the reactive schizophrenia is observed through the behavioral outcomes to the environmental stimuli. That is, sudden onset of emotional turmoil. If there is a stimuli that initiates a kind of emotion in an individual, the normal individual responds with the normal behavior. But individual suffering from the schizophrenia reacts with emotional outburst or emotional turmoil, experiences excessive confusion and decision making or the understanding the intensity or the type of stimulus. The expressions are kind of nightmarish. That individual is not comfortable with the stimuli. The sudden change in the behavioral pattern and speech becomes highly disorganized or the unstructured. Now, what are the symptoms of schizophrenia? Dear friends, schizophrenia is the only mental disorder that have bipolar symptoms. Bipolar means negative as well as the positive symptoms. So positive symptoms means the symptoms related to the abnormality that are present in the individual. Such symptoms are known as positive symptoms. For example, hallucinations pertaining to all five senses, exaggeration or distortion in the perceptual ability, unreal belief system and the beliefs, inappropriate behavior, manifestation of improper speech, illogical thinking, exaggerated irrational fears, a kind of excessive phobic reactions. Whereas the negative symptoms are the abnormal symptoms which are absent in the individual suffering from the schizophrenia. That is, lack of emotional expression, generally known as flat effect. There is a no response of the individual in response to the stimuli that initiate emotional expression and the reaction in the normal individual. So there is a kind of flat effect. Lack of cognitive integrity, loss of feeling pain and pleasure, absence of logical behavioral expression and responses, indifferent to external and internal stimulation, lack or minimal speech production, and impaired abstractness. There's one trick to remember the difference between positive and negative symptoms. The negative symptom starts with the word either lack, loss, impaired, absence, etc. So by just looking at this sentence itself, we can identify whether this symptom belongs to the positive part or the negative part. So what are the general symptoms of schizophrenia? You know, it's a comprehensive umbrella term which consists of a comprehensive range of symptoms. And psychology considers that each individual is unique. Hence, each individual shows the varied symptoms. However, for the ease of management, for the ease of understanding the disorder, the common symptoms are classified into following 5 categories. That is, breakdown of perceptual filtering, disorganization of thoughts and emotions, anxiety and panic, delusion and hallucinations, and withdrawal from reality. The consequences: people with schizophrenia are 2 to 3 times more likely to die early than the general population. A disturbing trend. The marked impairment in daily activities, including your professional life, social life, and family life. The increasing severity sometimes leads to involvement in dangerous activities, which are not only dangerous to the self, sometimes to the others, including family members or the peers. Then cognitive functioning is severely impaired. And the cognitive functioning includes attention, perception, memory, learning, information processing, problem solving, decision making, judgment, and other activities which are regulated and controlled by the prefrontal cortex. Cognition is the first casualty of schizophrenia. Personality gets distorted, leading to loss of self and social identity. Individual becomes insensitive to the immediate environment. That means stop reacting to the environmental stimuli. Stigma, discrimination, and violation of human rights of people with schizophrenia is commonly found around the globe. This is suggested by the World Health Organization. So here I appeal to the general population that kindly do not discriminate such people. They are the patients and deserve medication and psychological treatment. Kindly do not consider them different from you. The only difference is they are suffering from some kind of disorder and you are normal. So that's all about schizophrenia. These are my references. If you want to gain more insight into the introductory part or the historical aspect of schizophrenia, just refer them. They will help you out in the long run of studying psychology. Okay, dear friends, if you love and like the contents and the presentation style of this video, tell to others. But if you have any question, any query, or any critical comment to make, just drop a comment in my comment box, or you can email me at vamasujit@yahoo.com. And don't forget to watch my next video on nature of schizophrenia. Thank you friends for watching.